Hello, my name is Mark Eldore, and I'm the owner-proprietor of Athens Women's and Children's Center. I'm also an owner-partner in Ageless Image Medical Spa here in Athens. I'm a board-certified OB/GYN physician, and as such, my practice has primarily consisted of healthcare for females. However, as a certified practitioner of BioTE, I'm an expert in the bioidentical hormone replacement for both women and men. I practice in Athens, Texas, where I and my colleagues are the only such regional experts. In order for you to learn more about bioidentical hormone replacement therapy using the BioTE method, I've prepared this informational video. Rather than going over this general information in the office, I've chosen to provide you with this presentation, which you can go over in comfort and at your own pace. That way we can focus on you in the office, where I can answer your specific questions and address your concerns. Those of you choosing to undergo treatment with BioTE will be asked to sign a statement stating that you have in fact reviewed this material, so please stick with me throughout the presentation. Subcutaneous hormone pellet therapy represents a major change in the approach to hormone replacement. This difference is so unique that I prefer the term hormone optimization over the conventional term hormone replacement. As opposed to the conventional approach, which more often than not utilizes pharmaceutical products prescribed by your physician, BioTE pellet therapy uses bioidentical estrogen and testosterone pellets, which are inserted into the fatty tissue in the hip region. There are several critical advantages to this treatment approach. First, the use of bioidentical hormones, the exact same molecules that your body makes, ensures that the hormone receptors in your body are stimulated in a healthy and predictable way. Secondly, direct release of hormones into the bloodstream avoids what is known as the first pass effect, a phenomenon which occurs when drugs are absorbed through the gut and then go straight to the liver. This can lead to unhealthy side effects and toxicities. Thirdly, pellet therapy allows for a much more efficient absorption of hormones into the bloodstream, which allows for much more optimal levels. One thing that I would like to mention is that although pellet therapy is catching on in the United States, it is still far from mainstream. It is important to understand that many medical professionals do not understand the usefulness of testosterone therapy in both men and women. In fact, medical students and residents, myself included, are taught that women do not need much testosterone to function normally. Furthermore, conventionally they are taught that estrogen therapy is associated with significant health risks and that testosterone use leads to dangerous toxicities and side effects. I myself finished my formal medical training in 1999 and practiced very conventionally through 2011 when I was introduced to bioidentical hormone pellet therapy. I now know that not only are there no significant health risks, but that bioidentical estrogen and testosterone pellet therapy is extremely helpful and healthy throughout the body. As my patient, I just want you to be aware that other medical providers who are unaware of the benefits of bioidentical hormone pellet therapy may give you strange looks and even try to convince you to avoid it. Any such recommendations and comments will be meant to help you, but will be based on misconceptions and confusion. You, in fact, may need to educate them about the fact that tens of thousands of people like you have enjoyed the restorative benefits of bioidentical hormone pellet therapy in the United States over the past several decades. This therapy, which has been popular in Europe as well, is well studied and has universally been found to be safe and effective. In summary of this point, I want you to understand that I would not recommend it, as I have to my friends and loved ones, if I was not 100% convinced of its safety and efficacy. I would suggest that you reassure your other medical providers that as your physician, I am aware of your medical history, that I have ensured that you are current on your annual health maintenance, and that I am expertly guiding your hormone pellet therapy. So, why undergo bioidentical hormone pellet treatment? Hormone balance gives you the ability to be fully present and productive each and every day, creating wealth and abundance in all aspects of life, financially, emotionally, physically, and spiritually. Every day I see the dramatic improvements in the health and vitality of my patients, and I see their excitement in sharing their knowledge with their friends, colleagues, and family members. What is BioTE therapy? It's a therapy that helps your body return to the normal hormonal balance and physiologic state. It's based on delivering the right kind of hormone, bioidentical, in the right amounts, individualized dosing, using the right delivery system, pellets. Every day, 3,500 women enter into menopause. Symptoms of menopause can begin up to 15 years earlier. Male hypogonadism is present in 39% of males over 45 years old, according to the HIM study in 2006. Men lose up to 3% of their testosterone production per year after the age of 35. What you need to know is that, number one, not all hormone therapies are created equal. Number two, hormone replacement therapy is not a one-size-fits-all approach. And number three, you need an expert. So let's talk about estrogen therapy. What are its effects on the female body? Well, estrogen controls for hot flushes. It helps maintain bone mineral density. It helps to maintain memory. It reduces the risk of colon cancer. It helps to maintain collagen in your skin. It increases the neurotransmitters serotonin and dopamine. One thing to remember is that smoking and stress decrease the estrogen in your body. Testosterone is often called the brain hormone. Besides providing major symptom relief, it protects bones, brain, breasts, heart, joints, and relationships. Men aged 30 to 70 will lose 1 to 3% of total testosterone production per year. Women aged 20 to 40 lose 50% of their testosterone production. Yes, that's true. Women make and need testosterone. So then, what are the symptoms of hormone imbalance? Well, it often leaves you feeling tired, having mood swings, experiencing tension. It can lead to a lack of sleep. It can cause memory loss. People often experience a decrease in their sex drive. Depression and anxiety are also common symptoms. People can also experience physical symptoms such as hot flushes and night sweats. It is often associated with weight gain, joint pain, and an exacerbation of migraine and severe headaches. It also causes fatigue and a loss of erectile ability in men. Does any of this sound familiar? Although these symptoms are increasingly prevalent and severe with aging, they are definitely treatable. So let's compare the different methods of hormone therapy. Hormone replacement therapy methods include synthetic and bioidentical approaches. The synthetic products include pills, patches, and injectables. The bioidentical products include pills, patches, creams or gels, and pellets. Why are there so many concerns about the safety and effectiveness of hormone replacement therapy? Where did all of the confusion come from? Well, by and large, it is due to results of studies involving conventional hormone replacement therapy, such as the Women's Health Initiative trial, which finished in 2002 when it was ended early. This study showed a 41% increase in strokes, a 29% increase in heart attacks, a 26% increase in breast cancer. It showed twice the rate of blood clot formation, and a 76% increase in Alzheimer's dementia. It's important to note that after this trial, many women were left with no alternative for hormone balance and symptom relief. Sadly, there have been safe alternative methods available for years. Besides these known risks, what else do we know about the effects of hormone pills? Well, we know that they're associated with peaks and valleys in the hormone concentration in your bloodstream. We know that they're associated with first-pass metabolism. We know that they stimulate breast tissue. We know that when utilizing them, you have to take something every day. They can be associated with vaginal bleeding, blood clots, and headaches. More potential and unnecessary effects of oral estrogen therapy include breast tenderness, an increased risk of endometrial cancer and breast cancer, vaginal bleeding problems, problems with headaches, nausea and vomiting, fluid retention, blood clot formation, leg cramps, and gallstones.